American Medical Overseas Relief, AMOR, improving the health status of the communities we serve.
Following nearly 4 years of work in Afghanistan, in 2008, AMOR was established in Fresno, California, as a donor-supported 501c3 nonprofit organization. All donations to AMOR are tax-deductible.
AMOR'S mission is to provide health care to those people in impoverished areas who cannot provide for themselves, in particular women of childbearing age and children under 5, thereby positively impacting the community.
AMOR provides support, funding, and oversight to help local residents develop and operate medical facilities that meet the unique needs of their communities.
AMOR focuses on providing maternal and newborn care, children's health, urgent care, and health and hygiene education.
What distinguishes AMOR from other non-governmental organizations, or NGOs, is that we not only meet the immediate needs of the community in the countries we serve, but we introduce current internationally accepted standards of care. Most importantly, we strive for self-sustainability, meaning that we want the organization we create to be able to sustain itself. In 2004, Afghanistan was chosen as the first location in which to serve because, according to the World Health Organization, it had some of the worst health indicators in the history of the world. Afghanistan is one of the world's oldest civilizations, dating back to about 3000 BC. Strategically placed, it culturally connects the Middle East to Central Asia and the Indian subcontinent. Military campaigns in the area date from Alexander the Great to present day. Today, Afghanistan is one of the least developed countries in the world.
World Health Organization statistics show the average lifespan of an Afghan woman as 50 years, compared to 71 globally and 80 in the U.S. Afghanistan has an incredibly high fertility rate, averaging over 6 children born per woman. Unfortunately, more than 85% of Afghan women deliver their babies without skilled medical help, which means outside of a hospital setting. In 2005, almost 1/4 of children in Afghanistan died before the age of 5 due to preventable and treatable diseases. By 2011, the number was reduced to a still alarming 20%. Afghanistan has one of the highest maternal mortality rates in the world. In 2002, nearly 1 in 5 women died due to a complication related to pregnancy. That number has been improved to 1 in 7 women as of 2012, still an extremely disturbing number for a natural process. It is reported that 80 to 90% of Afghan women cannot read or write, making health education a challenge, one that AMOR is approaching and slowly making a difference.
Due to these shockingly grave statistics, plans were made in 2004 to build a hospital and address these issues. Land was acquired in the Afshar district of southwest Kabul, near Darul-Aman Palace. The location was chosen in order to serve the outlying communities lacking access to health care while minimizing security concerns. These communities surrounding the city would be drawn to the facility while providing services to those on the outskirts of the city. At the time, the location was 10 minutes outside of Kabul and was going to be the lone building. Placing the hospital here has created substantial growth in the area.
It's important to know that Kabul's infrastructure when the city was first built was designed to accommodate 500,000 residents. Since Kabul is now one of the more secure areas in Afghanistan, it is estimated that over 4 million people reside there. In 2005, construction began on a 100-bed hospital in collaboration and coordination with local leaders and the Afghan government. It wasn't easy. There were roadblocks. In an area that has seen great upheaval in recent years, inherent problems had to be overcome, like getting the first medical shipment into the area, which took 6 months.
For night shifts, staff arrives before dark and rotates through 16-hour shifts because it's not safe to travel at night. The hospital provides a kitchen and separate sleeping areas, as well as a daycare. Afghans' preconceived and usually misinformed prejudices had to be overcome as well, like a worker fearing he'd be shot if he didn't complete his work properly. Establishing trust by working side by side with Afghans proved to the local community how dedicated AMOR is to helping.
Misconceptions quickly began changing, and people's lives began changing. AMOR accomplished what they were told could not be done, and without engaging in bribes. Clean financial audits by firms like Ernst & Young, an internationally accepted accounting firm, prove this track record. So, AFGHAN Hospital opened in April 2009 as a 100-bed, $4 million facility with outpatient, urgent care, and hospital services in a 40,000 square foot facility with round-the-clock security. From a vacant lot has grown a hospital, and the area surrounding it has experienced unprecedented growth with new shops, a mosque, TV station, and a market. A community has been created around the hospital.
The first month AFGHAN Hospital opened in 2009, it treated over 700 patients. Now, it treats an average of 3,500 a month.
2/3 of patients are women and children, the focal point of AMOR'S efforts. AFGHAN Hospital sees patients with illnesses and injuries any American hospital would see, and rarely sees injuries resulting from acts of terrorism or war.
For example, most patients seen are for prenatal visits, pregnancy-related problems, upper respiratory tract infections, digestive problems, and chronic diseases, just as in U.S. hospitals. Does that sound familiar? Our primary focus is to treat women of childbearing age and children under 5.
Doctors and staff are paid a good wage by Afghan standards. AMOR has established AMOR Afghanistan Health Organization, legally recognized to conduct its affairs within the country.
AFGHAN Hospital sees all individuals, regardless of religion, ethnicity, or gender. The same is true for staff. All individuals are considered for employment based on their qualifications, without regard to ethnicity, cultural background, religious affiliation, or gender.
Even though it is difficult for women in Afghanistan to receive an education, AFGHAN Hospital has actively sought women for employment in all areas of the hospital. One area of particular sensitivity is a cultural norm that states male doctors do not treat female patients. We are pleased that we have been able to find qualified female physicians and staff to help overcome this challenge at AFGHAN Hospital. AMOR'S healthcare model is designed to improve the health of women and children in the project areas, while strengthening local health systems, collaborating with the Afghan Ministry of Public Health and other major players in Afghanistan.
At AMOR'S Afghan Hospital and clinics, AMOR'S healthcare model meets the current and future needs of its regional population by still growing into its space, readying a neonatal nursery and opening more inpatient rooms. It offers outpatient as well as inpatient care, surgical, maternity and pediatric services, radiology and laboratory departments, urgent care, and a pharmacy.
AMOR is building a strong local healthcare system. Employing the model of community and primary care medicine, local healthcare issues are identified. Early intervention and preventive measures are instituted to help people as quickly as possible. Attempting to improve the health of the local communities, AMOR supports 5 small clinics that care for women and children in outlying communities. COPE, Community Outreach and Patient Education, reaches over 1,000 patients per month, women and their children, through rotating clinics out of the homes of community leaders. Established at the end of 2009, these clinics are offered throughout the city of Kabul's poorest areas, where women are often prohibited from seeking health care. COPE provides high-risk screening checkups for pregnant women, regular prenatal care and vaccines for children, educational classes for women on the topics of nutrition, family planning, hygiene, and breastfeeding.
In the fall of 2012, AMOR was in the process of opening a multi-room clinic at the ASHCIANA school. It will serve 7,000 registered street children and their families throughout the Kabul area. Located at the ASHCIANA School for Orphans and run by ASHCIANA Afghanistan, another NGO, it will also serve families from the neighborhood. As one of the few clinics in the area, it will be the only one to provide care for these children.
Plans to add an additional permanent clinic in the Dashti Barchi area of West Kabul are in the works with the Ministry of Public Health. It will provide basic health care services to another extremely impoverished area.
AMOR is expanding its training and education programs. In July 2009, a primary care residency program was established to help meet the needs of patients and build the future of medicine in Afghanistan. AMOR dedicates itself to continuous physician, nurse, midwife, and staff education and training in an effort to raise the standard and quality of care, not only in the hospital, but wherever possible.
The hospital and clinics are dedicated to providing equal employment opportunities to all who are qualified. This is difficult in that there are very few female physicians in Afghanistan. In this regard, Afshar Hospital has gone out of its way to seek out, train, and employ female physicians. By providing steady work to 155 employees, of which 53 are women, AMOR has a positive socio-economic impact. In fact, it could be argued that this is the real value of what AMOR is creating, although that may be difficult to explain to the nearly 4,000 people a month receiving medical care.
AMOR's goal is to achieve sustainability by establishing its healthcare model via the hospital and multiple clinics. Through organizations who support this vision, like AmeriCares, Cooper Surgical, Abbott Pharmaceuticals, and Granville Homes, to name a few, and thanks to donors like you, AMOR'S healthcare facilities in Afghanistan are on their way to being self-sustainable, which means they'll be able to completely provide for themselves and all of their needs. The hospital's revenue supported 35% of its operating budget in its third year of operations, up from only 10% the first year, evidence that self-sustainability is possible.
AMOR'S Afghanistan projects are guided by its 8 principles.
Afghans for Afghans. Instead of bringing in workers from outside the country, like many NGOs, AMOR educates Afghans so they can, in turn, teach other Afghans. And this allows them to make their own informed decisions and provide for themselves. Additionally, we support the Afghanistan Ministry of Public Health and their objectives.
One of AMOR'S goals is to improve the health and increase the life expectancy of women during childbearing years. Another objective is to reduce children's mortality rates by preventing illness through proper vaccinations and by providing early treatment and appropriate care through regular visits, particularly for children under 5. For example, due to regular prenatal care and then proper postnatal care, healthy triplets were born to a local woman named Anisha, a first-time mom.
Because Afghan physicians are poorly trained and graduate without practical training, AMOR has implemented a U.S. model primary care residency program. By training female physicians, of which there are very few, AMOR will leave behind a legacy of world-class Afghan physicians to serve their people.
AMOR conducts all financial matters in accordance with internationally accepted accounting standards.
AMOR will provide accurate statistical information to allow for outcome measurement and assessment.
AMOR is proud to have a positive socio-economic impact in the communities we serve. We will create self-sustainability, which goes beyond the collection of revenue. AMOR's goal is to make the healthcare model implemented capable of surviving after AMOR no longer oversees their operations.
By educating the Afghan people on every level, from administration to hands-on medical care, They'll be able to use this knowledge to improve their community and their country.
With additional donations, AMOR can fulfill its mission of improving the health status of the communities that we serve. AMOR'S medical facilities currently treat thousands of Afghans throughout the Kabul region, and we're looking to expand into other underserved areas of the world.
Administrative oversight, accounting diligence, with appropriate medical care, unmotivated by profit, AMOR creates an environment whereby a relatively small amount of money can have an extremely large impact.
AMOR is changing people's lives and their communities, now and in the future, for the better.